Good afternoon, friends. You are listening to EBC Radio 1170 AM, Aapki Choice. And you know, we all have some kind of disorders, or whether it's health related, behavior, mental, or so many different bad habits we all form in ourselves, which we are not aware of. So today, in our health education series, which is brought to you by RWJBarnabas Health, we are going to be discussing about eating disorders and behavioral health. And to talk on that, we have Linda Mullin in the studio. She is the clinical director for the Eating Disorder Program, part of the Robert Wood Johnson Barnabas Health Behavioral Health Services. A licensed professional, counselor, and clinical supervisor, she is responsible for directing the clinical operations of the inpatient and outpatient programming. For the past 16 years, Linda's areas of expertise, in addition to eating disorder treatment and trauma, grief and anxiety disorders, Linda's focus is as a change agent focusing on innovative and strategic approaches toward mental health care, delivery in varied clinical settings supporting the community. So I know there are millions and millions of people, whether they are children, adolescents, adults, they all have so many disorders for eating habits, and we don't even know that we have that. So let's connect with Dr. Linda Mullin and welcome her on EBC Radio. How are you doing, Linda?
I am well. Thank you so much for having me today. I'm happy to be here.
It's a privilege and honor to have you in the studio, and it's a very interesting topic, and which I think none of us are aware what we are doing to our body and mind, and it is fantastic to have you in the studio to educate our listeners on eating disorders. So can you tell us briefly, what are eating disorders?
Great question. Yes. So eating disorders, I'll start with, affects approximately 9% of the U.S. population, which to you and I means about 30 million children, adolescents, and adults in the U.S. Mm-hmm. Eating disorders, they are not simply about food and weight. It's about how we cope with our emotional issues.
Okay, so so many times we just, without even thinking, we open a chips bag and we just constantly keep eating. So you think something on that line, you would call that as a disorder or is a bad habit?
Actually, what happens is we categorize eating preferences or how we eat in two different categories. So there's eating disorder and disordered eating. Oh. Sometimes when we're not paying attention to how we're eating, as if watching TV and we consume a bag of chips, we would say that was disordered eating versus an eating disorder.
All right. So now what are some of the common symptoms for eating disorders?
Many of the eating disorders have telltale signs for each of them. Mm-hmm. The most significant are weight fluctuation, food obsessions and rituals, body image concerns. Many people will eat secretively, have mood swings. They'll often be cold, experience a lot of fatigue, and the symptoms vary from moderate to severe depending upon how engrossed in the eating disorder an individual is.
Okay. So now for our listeners, what are the types of eating disorders that we treat at Robert Wood Johnson University Hospital in Somerset?
There are 5 classifications of eating disorders, and we support each of them. That would be anorexia nervosa, bulimia nervosa, binge eating disorder, ARFID, which is not very well known. It's avoidant restrictive food intake disorder. And then OSFID, which is other specified feeding or eating disorder, which means that an individual exhibits symptoms from each of the classifications, but not completely for one of them.
Okay. So can you explain this in a little bit simpler way so that people who do not understand these technical terms, they can be, a little more understanding it?
Absolutely. So anorexia nervosa would be an eating disorder in which individuals restrict food. They are often fearful of gaining weight, and they have a distorted body image. Mm-hmm. Bulimia would be individuals who eat large amounts of food and then purge it by vomiting or laxative use, sometimes compulsive exercise and fasting. These large amounts of food are actually larger in quantity than what is acceptable by the norm.
Okay.
Binge eating disorder would be individuals who regularly eat much more food than most people, often quickly, and they often cannot stop when they are full.
So these are the different ways they can, without even thinking, all these things are going on in their lives and they don't know, I guess. They need to be aware of those disorders and get treated, right?
They do need treatment, yes.
Yes. So tell us more about how eating disorders do not discriminate and can be found in all ages and in all cultures. Are we seeing any increase in adolescents?
Yes and yes. So there are zero boundaries with eating disorders. They can affect anyone. It doesn't matter age, culture, gender, nor does it matter socioeconomic status or religious affiliation. We have observed an increase in adolescents with eating disorders. There have been many studies. Many of the reports indicate factors such as social media, societal pressures, family and environmental pressures, other mental health struggles also to be contributors to the rise. Many teens actually experienced an exacerbated level of symptomology during the pandemic, and that was primarily due to the increased isolation and changes in daily routines.
Okay. So now tell us about the new EDU unit and what is special about it.
It's a terrific unit. It has recently opened in the past few years. It's an 18,400 square foot featuring 10 adult and 10 adolescent private rooms. It's a beautiful, architecturally designed facility. It has an ebb and flow of soft lines and colors. It simulates themes with nature, so it has mood lighting to promote calm and soothing atmosphere for patients.
Okay. So now how can listeners get more information about the eating disorders program at Robert Wood Johnson University Health in Somerset?
Sure. They can visit our website at www.rwjbh.org/eating disorders, or they can call our Access Center for more information at 1-800-300-0628.
All right. So now, doctor, tell me that what is your message to the people who have these eating disorders and they're not aware of, or they are aware of? So what tip you want to give them in the end so that they avoid these things?
Sure. Eating disorders can be very complex. They can lead to severe medical complications. They are treatable, and we can recover fully. I think that the biggest thing individuals should know is that help is out there, and receiving a full workup, getting checked out by a professional who specializes in eating disorders, will be the first step to understand what kind of treatment they need.
Yeah, because all this food is something I feel brings you into a lot of other problems in your body, right? Like if
it can, yes. Lack of food and severe malnutrition can lead to medical concerns with your heart, with your kidneys, with your liver, digestive system.
Yeah, as in South Asian community, like diabetes and cardio, those are very highly known diseases. And I think the food plays a very big role in those, right?
Food can have a play in what happens within our body. Yes, it can.
All right. So with that, I thank you, Doctor, for coming on airwaves of EBC Radio and talking on this, such a knowledgeable information to our listeners. And I would like to give a big thanks to Robert Wood Johnson Barnabas Health for supporting this health education series today on EBC Radio.
Thank you so much for having us.